Hi, I'm Dr. Sherwood, one of the urologists at Oregon Urology Institute, and I'm excited to tell you about a new procedure that we are starting to offer for men with BPH. It's called Aquablation. To give you a brief overview of the procedure before we get into the weeds a little bit, it is a procedure that removes prostate tissue and helps you urinate much, much better. And it does so with live ultrasound guidance. It's watching the prostate in real time. And it's using a water jet that is similar, the idea at least is the same as, a pressure washer like you might use on your driveway, except it's very, very precise, and it follows a treatment path that we prescribe so that we don't injure any, nearby structures, and we only remove, prostate tissue. And it is very accurate and works very well and is very quick for performing this type of a procedure, even for much, much larger prostates than we can do with other types of procedures through a transurethral approach. One of the great things about this procedure is the preservation of sexual function, which is oftentimes what keeps a lot of men from proceeding with some of the options like TURP or other procedures on the prostate that can have a drastic impact on how well you urinate. One of the side effects with other procedures would be the loss of the ability to have fluid come out of the penis when you ejaculate, though it should still feel the same with those types of procedures. And that's called retrograde ejaculation, and that does not happen in aquablation in 89% of patients, which is pretty remarkable. 100% of men came out of the procedure with the same function of erections that they had prior to the procedure, and over 99% had no issues with continence after the procedure. Before we go too deep into the procedure, I'm talking to a wide audience here, and I want to make sure that everybody's on the same page and may have not heard this conversation before on why it's important to consider a procedure on the prostate and just how the anatomy works. So let's focus on the picture on the left here real quick. This is a normal bladder, normal urethra, and then the prostate is a gland that surrounds the urethra, kind of like a donut with a hole in the middle, and you have to pee through the hole in the middle. In order to urinate, you really need two things to happen. Number one, your bladder's got to be able to contract or squeeze. And then number two, that urine has to be able to go somewhere. Easy physics, right? Now, as the prostate grows, it starts to pinch off the prostate, which is where the symptoms of BPH come from. And so it may look something like this. So we always talk about prostate, right? This is you have benign prostatic hyperplasia and medications for your prostate. You've got a big prostate and all that. But really, the story is a little bit more about the bladder than it is the prostate. While the prostate is the offender, is what's causing the symptoms, the bladder is what's suffering, and the reason we need to pay attention to this. So as the bladder has to work extra hard when the prostate is pinching things off, your bladder may go through a couple stages of deterioration of its health, ultimately leading to the potential for bladder failure. Step one in this process is having the weak stream, like we just talked about. Now, your bladder is fantastic at being able to compensate. So over time, the bladder may start to squeeze harder, right? Those bladder muscles work harder. They allow the pressure to be higher and shoot urine out through a tight opening of the prostate and maintain your ability to urinate. But as those muscles of the bladder are overworked, they start to become pretty irritated. And that's where we get to stage two here, where you have some frequency of urination because the bladder is stressed, the urgency, you may feel like you have to run to the bathroom to urinate, and you may have to get up at night quite often to urinate too, which is pretty bothersome. In addition to that, you may be leaving some urine behind when you urinate. A lot of people skip stage three here and go right to stage four. But sometimes for stage three, the bladder can act out and outside of your permission contract and cause episodes of incontinence that obviously are bothersome. Now, step four, or stage four here, is kind of where you're teetering between the bladder's ability to compensate and starting to lose that ability. And that's where, suddenly you might not be able to urinate. You end up in the ER and somebody's got to put a catheter in. Hopefully at that point we can intervene. That sometimes is the first time that we're meeting you or the first time that you're seeing a urologist. But hopefully we can do a procedure to open up the prostate at that point or start medications or whatnot to get you urinating again. But oftentimes it's not that far off from step four to get to stage five, which is bladder failure. And at that point, your bladder has exhausted its ability to contract. And, for example, if we at that point were to do a procedure to totally remove the prostate so there is no obstruction when the bladder's trying to squeeze urine out, the bladder still wouldn't be able to urinate. And therefore, the only treatment for that, unfortunately, is to have a catheter for life. And the bladder is not something that can really be um, transplanted. So, we definitely need to take care of it and consider intervening before we get anywhere near that point. Here's another look at, when we're looking with a camera from the inside of the bladder should look like this on the inside, a nice smooth surface. But as those muscles build up, you can start to see them manifest in the bladder, and you may be able to see this when we look in your bladder. And this is what it can get to, the point where it's permanently damaged, and these muscles are very thick and really don't function. So you're probably fairly familiar with some of the treatment options for BPH. May already be on some medications or may have even had a procedure in the past. The current options for BPH all have particular limitations, and Aquablation does a great job of addressing these. So for medications, for example, they have obviously their own side effects, which I won't get into here. But you got to take the medications for them to work. So it's a lifelong treatment. If you stop taking them, they stop working. And then also they tend to be quite a bit less effective than actual treatments, for your BPH. This is a mechanical obstruction, and generally mechanical de-obstruction procedures work much, much better than medications that have a mild effect. There are some minimally invasive treatment options. We offer UroLift. Resume is a similar option that other practices may offer, and these tend to have some great results with opening things up a bit, but not nearly as good as an actual procedure on your prostate that we'll talk about here in a moment. They oftentimes let you get off of medications, which is, I think, a good use for these types of procedures. And oftentimes they could be all that you need, but they do certainly have a higher likelihood of needing another procedure or to continue medications or restart medications at some point in the future. And then with these treatments, you have certainly have some irritative symptoms, like feeling like you have to urinate pretty frequently, maybe some pain when you urinate and whatnot, that can last for days to weeks. You can have similar irritative symptoms with surgeries on your prostate. This would start with a classic TURP, or transurethral resection of the prostate, which is what TURP stands for. That's a fantastic surgery. It opens up the prostate channel to be a big, nice opening like we saw on that last slide, where it's a big opening to be able to urinate through, but it only works for prostates that are up to a certain size. You can't have a super large prostate and have a TURP procedure just because it takes forever and loses its effectiveness once you get beyond a certain size. And that's where HoLEP and simple prostatectomy are procedures that work very well for big prostates. We don't currently offer HoLEP at our institution because that requires a lot of extra training. A simple prostatectomy is something that several of us do, but it does involve incisions through the abdominal wall, so it's real surgery to get down to the prostate and remove a lot of that tissue. And you certainly feel sore in the abdomen from having that procedure done for at least a couple of days. All of these procedures open up a big channel in the prostate, and therefore retrograde ejaculation is a potential side effect that is pretty common in these procedures. Also something you'll potentially experience with Flomax. What that is it's because of the way the anatomy is set up. Right here where my mouse is right now is where the fluid, when you ejaculate, it enters the urethra, and the bladder neck closes itself off so that the ejaculate goes forward and comes out the urethra, and you ejaculate. With these types of treatments, when the when the prostate is nice and open after a procedure like that, usually it's going to be the case that when you ejaculate, it just goes back into the bladder because it's less pressure to go that way. It's a nice open channel, which is not a medical concern at all, but it may be bothersome to you to not have anything come out when you ejaculate. It should still feel the same when you ejaculate. But every once in a while, I do have somebody tell me that they don't really like the sensation of ejaculation as much as before when nothing's coming out, and so that may be something to consider. And that's really an area where Aquablation shines. It's not common to have sudden erectile dysfunction after these types of procedures. That would be really rare, but it's not uncommon to have a little bit less erectile strength after these types of procedures, which is not the case with aquablation. And then incontinence, usually with incontinence after these types of procedures, it's because, again, if you look at my mouse down here, um, this is where the sphincter is that holds the urine. That's what you have control over to relax and start urinating. And as you can imagine, when you've got a big prostate like this, the sphincter gets pretty weak over time. It doesn't need to function that much because the prostate's holding the urine in, right? All of a sudden, you've got this big open channel after surgery, and you put a extra stress immediately on that sphincter. And sometimes it's not enough for that sphincter to hold in, and it may have a little bit of incontinence after any of these types of procedures. As that muscle builds back up its strength and holds the urine in. So it's rare to have lasting incontinence, but much more of a risk with these types of procedures that use energy or electrocautery or laser or whatnot near the sphincter where it's a potential for damage. Again, it's pretty rare, but always a potential. And that's not the case with aquablation. With these types of procedures, aquablation included, you may have some irritation symptoms just after the procedure. You may feel like you have to urinate more frequently and sometimes urgently for days to weeks. But typically your urine flow should be much better almost immediately after the catheter comes out. Bleeding is a risk. Most of these procedures would require you to stay in the hospital overnight with likely discharge the next day. And catheter duration is pretty dependent on the procedure, with simple prostatectomy even being a week or two of keeping a catheter in. So aquablation then is a fantastic procedure for a lot of reasons, and one of which is that it works on almost any prostate shape and size. Those other procedures really shine when a prostate looks like this or is this size, but if it has this anatomy or is too big, it may not be something that works very well. Whereas aquablation can work well for almost any prostate shape and size. It's also a very quick procedure. From the time that we start operating to the time that we're done operating for aquablation is often between 20 and 40 minutes, which is very, very fast. A TURP, for example, even on a very small prostate will probably take an hour, and it goes up from there. If you've got a very big prostate, a TURP will sometimes take 2 or 3 hours, and aquablation is much quicker than that. We talked about how aquablation spares sexual function in that first slide, as well as continence. Catheter time is pretty variable. For example, somebody who can't urinate at all right now and just has a catheter in, it's a good idea to make sure that we let things heal up a little bit more before chancing taking the catheter out after the procedure. So probably keep that in for 5 to 7 days or so. Whereas if you don't have a catheter in right now and you're urinating pretty well, likely that we'd be able to remove the catheter the day after surgery or within 2 or 3 days. Most of the time, we'd keep you in the hospital overnight and take the catheter out the next morning. But with the ability to potentially send you home the same day, it may be the case that we keep you a few hours after the procedure and let you go home and take the catheter out yourself at home, in a day or two. All right, there's a video that talks about the procedure here. I'm going to just show you a couple little parts of it so you get an idea of what the procedure is like. The procedure actually starts by putting an ultrasound probe into the rectum, and that allows us to visualize the prostate in real time throughout the procedure. The camera goes in through the urethra, and then while we're visualizing the prostate, we really go through layer by layer here and tailor the treatment area to the anatomy of your prostate. So this is very patient-centric. Every treatment is different and geared toward your prostate. We mark areas where we're trying to be extra cautious around the areas of ejaculation, for example, and at the bladder neck here, and then we start the treatment, and it goes back and forth and just uses the water jet to go through that area where we had outlined, and then spares this tissue here that's important for maintaining ejaculations. Afterwards, we do go in with the standard equipment like we would use for a TURP, just to be able to take a look around, make sure that we have a good, nice opening there for you. And then there's always going to be a couple little areas where there's some bleeding. And so we use that instrument to apply some electrocautery just in very specific locations to make sure that the bleeding has stopped before the procedure is over. And then we take the camera out and put a catheter in. Basically, this slide just shows that you have great improvement in your urine stream and quality of life and urination symptoms almost immediately, and that those go out to 5 years, which is how far we've been monitoring things on the most recent published data. All right. Well, in conclusion, I am happy to announce that we're now offering aquablation at Oregon Urology Institute. I think it's a great treatment option for men with BPH, and I'm excited to be able to offer that to our patients. If this sounds like something you'd be interested in, please contact our office and let us know. Get you worked up and see if it's something that you would be a good candidate for. And then I've also put a link to the patient website for aquablation that can get you there so you can do a little bit more information on your own about it as well. Please let us know if you're interested or if you have any other questions. And thanks for taking the time to watch this video, and hope you have a great day. Thanks.